Good morning. This is my second attempt at recording my first webcam with you all. Um, I will see if this works out. This is our vital signs. I have 15 minutes to get this done. All right. We have 4 vital signs of the body. They are the temperature, our pulse, which is our heart beating, our respirations, which is our breathing, and our blood pressure, how hard our heart is working. Measuring or reporting the vital signs. Our vital signs are measured to detect changes in normal body function. They also tell about responses to treatment. For instance, if I went through a surgery, it would tell me how I was responding to post-surgery treatment. If I had a blood transfusion, we'd be monitoring my vital signs. It says it often signals life-threatening events. If I'm having a heart attack, my vital signs are definitely going to change. And they are part of the assessment step in the nursing process. So it's one of the first things that you have done when you go into the doctor's office. Your vital signs are measured during your physical exams. When the person is admitted to the nursing center, even if you just go in for something simple, they're going to take your weight, take your height, do all that stuff. As often as required by the person's condition, vital signs might be taken very frequently if you're in a post-surgery condition, for instance. Oh, here we go. I went before and after surgery. It says before and after complex procedures or diagnostic tests. After some care measures such as ambulation. Ambulation is walking. They get you up and have you walk to help circulate your blood, which will prevent blood clots. After a fall or other injury, if you fail and they were worried about you having a concussion, they'd be taking your vital signs very frequently. When drugs affect the respiratory or circulatory system, when there are complaints of pain, dizziness, lightheadedness, shortness of breath, rapid heart rate, or not feeling well. And as stated on the care plan. A care plan we haven't really discussed that much, but a care plan is what's in place as to how your care for your condition will be outlined. They don't always reinvent the wheel in the medical world. If there's a heart attack, they have a care plan in place as showing you the steps that should take place in order to deal with a patient who's a heart attack sufferer. Does that make sense? Alrighty. Accuracy is essential when you measure, record, and report vital signs. Unless otherwise ordered, take vital signs with the person lying or sitting. The reason why it said unless otherwise ordered is, for instance, they might order vital signs during a stress test. So they might put them on like a walking machine. It says also to take vital signs when the person is at rest, when vital signs are measured. I think I just said that. All right. Oh well. Report the following at once. Any vital sign that has changed from a prior measurement. Vital signs above the normal range and vital signs below the normal range. We're getting ready to go into normal ranges here in just a moment. If you cannot measure vital signs, tell the nurse right away. You might not be able to get that blood pressure, or you might not be able to get a good temperature, or the patient might fight you. You need to report that at once. Body temperature is the amount of heat in the body, and thermometer is used to measure temperature. It is measured using the Fahrenheit and centigrade or Celsius scales. We use Fahrenheit predominantly. You'll see Celsius more in foreign countries. Temperature sites are the mouth, rectum, the axilla, which is the armpit, the tympanic membrane, and temporal artery. And the tympanic membrane is the ear, and the temporal artery is across the head. Fever means an elevated body temperature, elevated up. Always report temperatures that are above or below the normal range. these types of thermometers are used. We haven't taken temperatures in here yet. We're going to be working on that. We have glass thermometers is what we utilize. A lot of you probably have those at home. Or you might have the electronic thermometers. You most likely, when you go to the doctor, that's how they're taking your temperature. It's usually oral, right? They're putting it in the mouth. But you might do a rectal temp. Rectal temp is your most accurate temperature. It is closest to the core of the body. So if there's any question about temperature rises, the doctor will order a rectal temp to get the most accurate temperature. Your tympanic membrane thermometers in the ear, I don't see those used as much anymore. I had one when my children were first born. They can be, it's all about how you take the temperature. If you're doing it accurate, that it could be easily non-accurate. The temporal artery, the one they just rub across the head. There's digital thermometers, there's disposable oral thermometers, and there's temperature sensitive tape. I got pictures here to show you. There's how you read a thermometer. This is the glass thermometer. If you can see that each one of those tick marks up there is worth 2 mm's. No, that's on blood pressure. I'm sorry. 2 degrees of Fahrenheit. Not 2.2, excuse me. So that's 98.6 that you're seeing as the normal temperature. ABC just shows you different shapes of thermometers. And then at the very bottom shows you 37 degrees Celsius as being the normal temperature. There she is, reading the thermometer, which you guys are going to practice with. She shakes it down because you've got mercury inside of the thermometer and you're trying to get it shook down so that you can take an accurate temperature. So immediately when you get that, you shake it down to get it down as low as possible, then you take temperature. Those are ones that are one use. It's a single-use oral thermometer, so it comes in a sheath. You're going to make sure you get it underneath. Everybody know what the frenulum is? That little piece there underneath the tongue. That's a rectal temp. There is a proper position for that. That's called the Sims position. You do have to be careful with those. You know, as far as it can cause a drop in heart rate. So, yeah. And thermometer underneath the pit is the axilla one of the non-preferable ways to take temperature, because you have to keep that there for about 3 minutes to get an accurate temperature, and plus with people sweating, it provides the least accurate temp. And there's what you see usually when you go into the hospital or into the doctor's office. It has a little covering that they place on it so it can be reused. If they get an inaccurate temperature from this, the doctor will most likely ask them to go and use a different measurement tool. There's your temporal. Just run that straight across the head, down across the ear too usually. That shows you the tympanic membrane. I'm not used to it going that far into the ear, but of course that's just a drawing. There's digital. That's another means of, I guess, showing a, that's not digital, but anyway. And there it is across the head. A pulse is felt every time the heart beats. So your pulse size. And there's a diagram to show this afterwards, but the temporal is the head, carotid the neck, the brachial, the one that we've been using for blood pressures, radial is what we've been feeling in our wrist, right, down from our thumb. Femoral is in the groin area, where the thigh meets the pelvic area. Popliteal is behind the knee. Posterior tibials behind the ankle pretty much. Dorsalis pedis is on top of the foot. The radial pulse is most often used. The carotid pulse is taken during CPR and other emergencies. And the apical pulse, which is felt over the heart. It says felt. You shouldn't say that. Yeah, you can feel it, but this pulse is taken with the stethoscope. There's picture. The use of the stethoscope. Wipe the earpieces and the diaphragm with antiseptic wipes before and after use. Place the earpiece tips in your ears. Place the diaphragm over the artery. And then we have to prevent noise, right? So we can actually hear through that thing. The pulse rate is the number of heartbeats or pulses felt in 1 minute. The rate varies for each age group. A baby's pulse is going to be like 120 to 180 beats per minute, whereas us adults, and you guys kind of fall into that, yours might be a little bit fast, but most of you are running in this between 60 to 100 beats per minute. That's what you're going to need to remember for the CNA test, 60 to 100 beats per minute. Report abnormal pulses to the nurse at once. If you can pull on your medical terminology, remember tachy means fast. Tachycardia is a fast heart rate. And brady means slow. Bradycardia is slow. There's the picture of the stethoscope. The rhythm of the pulse should be regular. An irregular pulse occurs when the beats are not evenly spaced or beats are skipped. Force relates to pulse strength. A forceful pulse is described as strong, full, or bounding. You'll hear me say that a lot. Oh man, their pulse is bounding. Hard to feel pulses are described as weak, thready, or feeble. And I hear some of you talking about that with your lab partners. I can't find their pulse. It's weak. You must count pulses accurately. You must report and record the pulse rate accurately. That's why this is one of those skills that we are learning that you will be tested on no matter what. There they are doing the pulse. That is a radial pulse. The apical pulse is on the left side of the chest, slightly below the nipple. It is taken with the stethoscope. Count the apical pulse for 1 minute. Count each lub dub as 1 beat. The apical and radial pulses should be equal. To see if the apical and radial pulses are equal, 2 staff members are needed. The pulse deficit is the difference between the apical and the radial pulse rates. If there is a pulse deficit between the radial and the apical, it could signal some kind of circulation issues.
Can you take a break for a second?
That's them taking the apical pulse. Okay, our respiratory rate. Respiration means breathing air. That's inhaling, and then going out is exhaling. Oxygen goes in, carbon dioxide goes out, and both sides of our chest should rise and fall when we count a respiration. Normal respiratory rate is 12 to 20 respirations per minute. They're normally quiet, effortless, and regular. Both sides of the chest rise and fall. You count when they're at rest. You count when you're taking the pulse. Keep your fingers or stethoscope over the pulse site. And last but not least, our blood pressure. It's controlled by the force of heart contractions, the amount of blood pumped with each heartbeat, how easily the blood flows through the blood vessels. The period of heart muscle contraction when it's working is called systole, and the period of heart muscle relaxation, diastole. Blood pressure is measured in mm's of mercury, mm of Hg. The systolic pressure is recorded, over the diastolic pressure. The way I remember that is I remember diastolic down, DD. So systolic is higher in the alphabet. It's over the top. Diastolic is at the bottom, diastolic down. Blood pressure has normal ranges, 120 over 80. Systolic 120, diastolic 80. If it's at hypertensive, it'll be above 140 over 90. And if they're hypotensive, it'll be below 90 over 60. We use a stethoscope and a sphygmomanometer to measure the blood pressure, and it's normally measured in the brachial artery. There's what we've been using. There's one you might see in an old hospital. There's the new way of doing it, which we love. There's the picture of how we do it. And this is how we would record our vital signs. Quality of life, you must protect the right to privacy when measuring vital signs. Always keep resident information confidential.